Back in 1991, I had to enter rehab. I had a problem with cocaine crack. And while I was in rehab, they had offered us the HIV test. So I went to get tested while in rehab, and it came back positive. Even though I was living that way, I was still very much surprised. You know, I think I was very much like everybody else. You know, I wanted to keep it a secret. I didn't know who to tell. So for the next 2 years, I basically didn't deal with my HIV, but I did try to get as much information as I can about it. I started working for organizations that had treatment education. I became a peer educator, then went on to become a case manager, and I just learned so much about HIV. And during the time, we had uncovered that most or a great deal of people with HIV who contracted it through IV drug use could have potentially also had Hep C. So while I was enrolled in a study, they did test me for Hep C as well. This is 6 years after being diagnosed with HIV, and found out that I was positive for Hepatitis C as well.
I met Gloria when I was doing an internship in Stand-Up Harlem. She was a substance abuse counselor and case manager then. When we got together, I knew she was HIV positive. And we never talked about hepatitis C, but like 4 years into our relationship, she came home and said, I have hepatitis C. And it didn't, you know, hepatitis C then, when I'm talking about 17 years ago, wasn't such a big deal. It wasn't talked about. So HIV was that's what I was doing at work, and that's what was happening. So I really didn't think about hepatitis C as gonna be detrimental to her health, or we're gonna have a problem. But I started seeing it more and more at work. So you have to put the same attention to hepatitis C that you do on HIV, because I'm not a scientist, but 96–97% of my clients are co-infected. So you have to make sure that you're doing both, or that you even talk about hepatitis C. It's very important. People are not talking about it.
Education is going to be the only thing that's going to make people understand that it's okay to be tested. I am a blessed person. Not everybody has the support that I have. Not everybody is as educated about the diseases that I am. And I spend every waking moment thinking about how to reach them. You know, I would say to everybody, whether they think they're at risk or not, I'm not a fan of the risk factor quote, period. I think if you've ever had sex, you should be tested for HIV and hepatitis and any other STI if you've had unprotected sex. That's me, that's the educator, that's the advocate, that's the mother.